child needs. Colds, fever, shots. Little Philippe Amzalog sees a pediatrician often, but his pediatrician comes to him. His doc makes house calls, something Philippe's dad says brings benefits beyond saving him a drive.
The drawbacks of having to go to an office to see a pediatrician include the concern that other children are sick around my child, the concern that the pediatrician isn't paying 100% attention to my child.
Dr. Ed Kulich points out other advantages. The kids are more relaxed, and he believes seeing a child at home gives him a better understanding of what might contribute to an illness or behavior issue.
I can pick up developmental signs that might not be seen in an apprehensive child. I also can give parents sleep training, which is very often overlooked because of the time constraints of a visit.
Pediatricians who make house calls are also referred to as concierge pediatricians. It's a growing trend, with physicians popping up across the country providing services outside the office. Dr. Russell Libby is the chair of home care for the American Academy of Pediatrics. He sees a trend evolving even more.
Especially as we start taking care of more complex kids at home, and as some physician practices may narrow it down to a smaller number so that they can provide better care.
I wanted to devote lots of time to each individual patient. Instead of seeing 30, 40 a day, I could see 3 to 4.
Parents may pay a higher price for the service, and in many cases they will have to pay the fees up front, then be reimbursed by their insurance company. But some doctors provide around-the-clock care in case of an emergency. Philippe's dad feels it's worth the cost.
Do it because there's no more secure feeling.
And if you are interested in finding a pediatrician who does house calls,